In a world where every step can be a struggle, where a simple bend feels like a battle, and where pain seems to have taken up permanent residence, there emerges a beacon of hope. Introducing manual therapy for low back pain and sciatica. Join us on this remarkable expedition of healing, growth, and empowerment. Manual therapy for low back pain. Number 1. Extension mobilization technique. This approach is designed to alleviate lower back pain by gently applying controlled pressure to specific areas of the spine, promoting extension, backward bending, of the vertebral segments. This technique is particularly beneficial for individuals with conditions such as disc prolapse or other mechanical issues affecting the lumbar spine. The controlled extension forces applied during this technique can help alleviate pain caused by nerve compression, muscle tension, or other mechanical factors. By creating more space between vertebrae, pressure on nerves and surrounding tissues is reduced. 2. Rotational mobilization technique. This approach is specifically designed to address lower back pain by gently introducing controlled rotational movements to the affected area of the spine. This technique aims to alleviate discomfort, enhance mobility, and promote healing through carefully applied rotations. The controlled rotation helps alleviate muscle tension, reduce nerve compression, and release pressure on the affected spinal structures, leading to reduced pain and discomfort. It also helps to improve the mobility of the spinal joints. This increased joint movement can contribute to better overall spine function and flexibility. The rotational movements stimulate blood flow to the area, promoting healing by delivering essential nutrients and oxygen to the tissues. 3. Individualized approach. This refers to tailoring treatment techniques and strategies to meet the unique needs of each patient based on their specific condition, symptoms, and responses. This approach recognizes that not all lower back pain is the same, and that effective treatment requires a personalized and adaptable approach. Before any treatment is initiated, a thorough assessment is conducted to understand the patient's medical history, the nature of their pain, its duration, and any contributing factors. This assessment helps the therapist determine the most appropriate techniques to use. Understanding the patient's pain pattern is crucial. This information helps the therapist select techniques that target the right areas. Throughout this transformative video, we've uncovered the remarkable potential of manual therapy as a beacon of healing for those battling the burdens of lower back pain and sciatica. In the artful hands of skilled therapists, we've witnessed the power of touch and technique as they guide us through a symphony of movements, mobilizations, and adjustments. We've come to understand that pain need not be a life sentence, but rather a challenge that can be met with resilience, knowledge, and the gentle guidance of a caring therapist. Our voyage has revealed that manual therapy isn't simply a set of procedures. It's a personalized journey towards liberation from discomfort and restriction. It's about empowering you, the protagonist of your own story, with the tools to reclaim your life and rediscover the joy of unhindered movement. Let us remember that healing is not just a destination, it's a continuous path that intertwines with knowledge, understanding, and the support of a community that stands with you every step of the way. Let us embrace the possibilities that lie ahead and approach each day with anticipation, armed with the newfound strength to face life's challenges head-on. If you found this video helpful, make sure to like this video right now. Subscribe to this channel and hit that bell button for more tips on lower back pain. Make sure to click the link in the description for a proven way to get rid of all kinds of lower back pain for good. Thanks for watching and see you in the next video.